So welcome everybody to the latest installment of a workshop series sponsored by Blueprint called The Future of Mental Health Care is Measurement-Based. I'm extremely excited to be here with all of you this afternoon, especially those of you who are new to measurement-based care, just starting to think about it for the first time. For those of you who are new to myself and my work, my name is Russell Dubois. I'm the head of clinical and customer success here at Blueprint. I spend most of my days working closely with group practices and behavioral healthcare systems, specifically focused on the implementation of measurement-based care. And through this work, I've seen the tremendous value that can come from beginning to integrate outcome measurement into your practice. And I've also seen like the good, the bad, and the ugly when it comes to implementation for clinics who are new to this practice and just starting out. So with that said, I'm a firm believer that everybody who provides mental health care should be measurement-based care or measurement-based in their approach. So because of this, I am very excited to spend the next half hour or so with you all and hopefully share with you why I feel that measurement-based care truly is the future of mental health care and what you all can do to get started if you aren't already practicing this way. So in terms of our agenda for today, I'll start by talking about why measurement-based care, like what it actually is. I'll cover some definitions and historical context, as well as where measurement-based care is today and where the field's heading into the future. I'll then talk about why you should care. So there's some significant benefits that result from measurement-based care, both for your clients as well as for you and your practice. So we'll spend some time presenting on what these benefits are. And then lastly, I'll end with some recommendations for where to get started, specifically focusing on implementation tips and best practices, as well as covering what I consider to be like the three most important things to look for when evaluating measurement-based care solutions and shopping around for a measurement-based care platform. So with all that said, we have 30 minutes together. These are some big topics. And so the purpose of this webinar is really to provide a general primer on these larger topics to hopefully set the stage and get you all, thinking about why you might want to start implementing measurement-based care if you aren't doing this already. All right, so starting from the top, most of you in attendance today probably already have had at least a general idea of what we mean when we refer to measurement-based care. There's a lot of different definitions out there. The one that I like the best states that measurement-based care is the systematic and recurring use of measurement-based feedback in therapy with the purpose of informing care decisions and treatment planning. And what I actually think is more helpful to clarify isn't what measurement-based care is, but rather like what it isn't. So measurement-based care is not just administering screening measures when a client first comes into therapy. It's not just measuring outcomes from intake to discharge, so you can use that data for some sort of outcomes report. It's not using certain types of measures just to rule out diagnoses or a condition as they may come up during therapy. It's really about a collaborative process between client and clinician, and in some cases, a treatment team, that ultimately helps make care more effective and efficient by bringing attention to a client's progress and experiences objectively so that this information can be used to inform or adjust care when appropriate. There are some defining features of measurement-based care that I thought would be helpful to highlight. One is that measurement-based care is an active, not a passive practice. And so what I mean by this is that clinicians and clients collaborate in understanding and responding to assessment results at regular intervals throughout the course of care in order to stay attuned to progress or lack thereof. So this sort of persistent attunement to progress is a key factor that makes measurement-based care work for clients and clinicians. Measurement-based care is also relational rather than simply being rational. So the active ingredient of measurement-based care taps into common relational factors associated with positive treatment outcomes. So things like alignment on treatment goals, therapeutic alliance, client expectation. Measurement-based care isn't about like a blind interpretation of assessment results and progress, but rather about the relational process that sort of unfolds when a client has the opportunity to track how things are going throughout the course of therapy, and then have conversations with their therapist about those results. And then lastly, measurement-based care, when done right, is oriented around the process rather than simply the outcome. So what I mean by this is that measurement-based care isn't just about tracking outcomes for the sake of tracking outcomes. It's actually like a way of being as a therapist. It's a specific type of therapeutic practice in and of itself. And when you focus on the process of providing high quality measurement-based care, the ability to measure outcomes will follow. It doesn't work the other way around. So that process of measurement-based care has to come before the outcome, which is a point I'll talk about later on in this presentation as well. So if you look back at the last few decades, measurement-based care has come quite a long way. Generally speaking, it was in the 1980s or so when the therapy field as a whole began to recognize measurement-based care as a marker of high quality mental health care. And that came in response to behavior therapy and CBT and just the emergence of these different evidence-based practices. But it wasn't until only about 7 or 8 years ago that measurement-based care really started to become the new standard of care. A critical event in the advancement of measurement-based care was the 2015 Kennedy Forum publication of the report titled "Fixing Behavioral Healthcare in America." And this report, it clearly outlined the widespread benefits of measurement-based care. It was a result of this large-scale national audit of mental health care and treatment outcomes. And it came to this like clear and definitive conclusion based on all of the available evidence and data that we had at that time, which said that one of the main contributors to poor outcomes in routine care is that providers do not typically use symptom rating scales in a systematic way to determine quantitatively whether their patients are improving. Yet virtually all randomized controlled trials with frequent and timely feedback delivered from these outcome measures to the provider during the clinical encounter found that outcomes were significantly improved compared to usual care across a wide variety of mental health disorders. So the reason I bring this up is because, number one, this was the first report that really recognized at a national scale measurement-based care as a clear value add to basically any therapeutic approach, regardless of treatment setting, treatment type, or patient population. And then number two, the report represented the first sort of firm call to action from the top down that, like, as a field, we need to do better at integrating measurement-based care into our work. At that time, this was back in 2015, they estimated that only about 20% of providers practice measurement-based care at any given time. So if we fast forward to today, it's become very clear that measurement-based care truly is the new standard of care. There's a couple points in particular that I want to comment on to support this claim. There's a growing body of evidence that shows that the use of feedback via self-report measures is a clear and consistent distinguishing practice or factor of top performing clinicians when compared to the rest of us. So if you want to provide the best possible care as a therapist, that care has to be measurement-based in some way, shape, or form. And then at the systemic level, nearly all top-rated national mental health care systems practice measurement-based care. It's just kind of like the way things work in these large systems. Accreditation organizations, organizations like the Joint Commission is a common one, are now mandating measurement-based care as well. So it's built into their review and accreditation criteria. On the insurance side, insurance companies are publishing call to actions for credentialed clinics and clinicians to begin measuring their outcomes. And then in doing so, they're also starting to widen their coverage of these assessment-based insurance claims. On the side of the APA is publishing treatment guidelines for select mental health conditions and requiring measurement-based care to be a part of those guidelines. PTSD is a good example of this. So all of these strongly supported treatment guidelines for PTSD endorsed by the APA have measurement-based care as a critical component. And then lastly, measurement-based care delivery systems are becoming more accessible, which makes the practice of measurement-based care feasible for these private and these group practices. So it's not just these like large health systems that are practicing this way. It's really sort of trickled down to everybody. And all of these facts just point to the notion or the idea that measurement-based care truly is the new standard of care. It's also interesting to look at some of the trends going on in the field at large, and it's clear that measurement-based care is going to become even more essential given some of these trends. A good example of this, you all have probably heard in some way about value-based care, which is insurance companies reimbursing for quality over quantity. While most of you in private or group practice are probably still on a fee-for-service payment structure, this will be changing, and critical to that change is the need for practices to begin measuring, managing, and demonstrating their quality of care through measurement-based care to be able to adhere to and keep up with these new, more sophisticated payment structures. There's also growing demand for therapy. So more people are starting therapy for the first time, largely as a result of an increase in access to care that we've seen in the past few years. And while an increase in access and more people seeking care is, of course, a good thing, therapy settings will need to become much more efficient in how clients enter care and are treated throughout the course of care. What's not written on this slide, but is very true as well, is that a side effect of this increase in demand is that clinicians are becoming oftentimes overworked, overbooked, which is leading to burnout. And so measurement-based care is going to become essential, not just in making the system as a whole more efficient, but also in making like the day-to-day life of therapists more efficient as well. And so they can manage the demands of their job without burning out. And then lastly, individuals who are seeking care for their mental health, so consumers of treatment, are more than ever becoming increasingly discerning in their expectations for what they should get out of therapy. So we've seen this exponential increase in access, but with that has come, in some cases, a compromise in quality. So there's a lot of clients that aren't getting what they need or what they want out of their therapy experience. And so clinics or organizations who will excel in the future are those who are able to demonstrate to those clients what they can expect to get out of care and why their services are better than the place, next door. If you look at organizations like Brightside is a good example, they're doing a great job at this. So they're openly publishing their outcomes in order to demonstrate their quality, specifically to individuals who are considering choosing them as a provider. So all this attention on measurement-based care in recent years isn't for nothing. Like there's a reason why it's gaining popularity. There's a whole body of research showcasing the many benefits of measurement-based care, but it really points, comes down to a simple fact, which is that when clients receive measurement-based care, they tend to get better quicker and experience a higher quality of care. So a recent meta-analysis found that compared to clients who receive standard care, those who were in the measurement-based care group were 20% more likely to stay in therapy. So in other words, 20% less likely to drop out. We've also found that clients who are clients who are in a measurement-based care group are up to 24% more likely to show up to their appointments as measured by canceled or no-show appointments. And then most importantly, that clients respond to treatment up to 36% faster with measurement-based care, in which assessments are used at each session. So this last point is depicted on the graph on the right. This shows the average rate of change, in this case, anxiety, across time split up among clients who received measurement-based care through weekly assessments at each session. That's the blue line. Assessments every other week or every other session, which is the red line. And then assessments only once a month, which is the green line. So what this shows is that while each group started at roughly the same severity of anxiety at their baseline, Clients whose clinicians administered assessments each and every therapy session, so each week, remitted quicker, up to 36% faster, and had significantly lower anxiety scores at week 16 than clients who experienced more of a mild form of measurement-based care. So this finding is particularly exciting for us, as it leads to the question, like, what other practices are there in our field are as easy to implement and yet have the potential to create such a large impact? In my view, like, this is why everybody should be doing measurement-based care, because we know it helps our clients feel better faster. And that's really what we're all about. It's also worth noting that measurement-based care can be good for business as well. So from a financial perspective, there's some direct or sort of frontline opportunities to drive a pretty strong ROI by practicing measurement-based care, one of which is in the form of either billing directly for assessments and or using the collected outcomes for insurance rate negotiations during contract renewals. So a detailed discussion on the billing and reimbursement side of measurement-based care is definitely beyond the scope of this presentation. Just a quick example here, like if you're a clinician, you're seeing 20 clients a week and you're doing 2 assessments on average per client per session, let's say a PHQ-9 and GAD-7 each time you meet with a client. And you're billing CPT code 96127 at a rate of $4 per unit, which is pretty typical for what we see among clinics who have this on their fee schedule. Then you're generating about $7,500 in additional reimbursement revenue each year as a therapist, which for some people can be quite significant. We also know that many clinics who are credentialed with certain insurance companies, when their contracts are up for renewal, will use outcome measures in their merit and expertise letter to negotiate higher reimbursement rates. This practice is sort of like a lightweight precursor to value-based payment structures, but done more on like a contract by contract basis. So let's say you're a clinician, you're practicing measurement-based care, you're tracking your outcomes and able to demonstrate your quality. If you're billing a 45-minute psychotherapy session, so that's 90834 at a rate of $100, and you are able to negotiate a 5% rate increase. With that same caseload, you'll also be generating just under $5,000 in additional revenue just from that rate increase. So, of course, how this actually plays out in the real world can be a bit more complex, but the fact remains that there can be a strong financial value in the practice of practicing and reimbursing for measurement-based care. And for clinics or organizations who are in payer markets that favor assessment-based claims, it really does work out quite well. And then alongside the reimbursement reality, or sort of like reimbursement-related opportunities, there's this long tail of additional benefits for practice owners. Measurement-based care, especially when using measurement-based care systems designed to save clinicians time and make their jobs a bit easier, can help drive better clinician retention so you can attract great talent and maintain that talent over the long term. As we spoke about on the last slide as well, measurement-based care can also improve client retention by reducing cancellations and dropouts, which can also have a very profound revenue implication at scale, especially when you consider the lost revenue from appointments that don't get filled when a client no-shows or cancels. And then lastly, there's some wonderful benefits for using measurement-based care in that process in supervision, in particular, helping to prioritize discussion of clients who are off track or who might need more attention. And the list kind of goes on from here. I would say if you're interested in learning more about the various benefits of measurement-based care for practices and practice owners, highly recommend checking out the blogs section on Blueprint's website. There's some great posts and resources to dive a little bit deeper into each of these subjects. But with all that said, the point I want to get across here is that measurement-based care is not just a practice that provides clinical value, but also one that provides some quite compelling and unique opportunities from the business point of view as well. which we know can be also very important. Okay, so where do you start? I know that a number one fear that many people, practice owners in particular, have is simply the fear of like adding something new for their clinical staff to do, given that they're already probably strapped for time and overworked. But if there's one point I want to make here, it's that implementing measurement-based care should be easy, especially if you partner with the right people and you start small. So don't let change anxiety get in the way of realizing all the benefits that can come from measurement-based care. I've helped literally hundreds of clinics implement measurement-based care, and I can tell you that 100% it is worth the effort, and in most cases leads to some really amazing success stories and positive outcomes. And of course, we don't have time for any formal implementation overview, but I did want to leave you all with 3 tips that I wish more practice owners I spoke with would be aware of or sort of thinking about when they start thinking about measurement-based care implementation. The first is this: so don't put the cart before the horse. And by this, I mean that if you, as a practice owner, if you're after outcomes and outcomes data, which I know a lot of you might be interested in, your clinicians, their engagement, and the clinical value that they and their clients get from measurement-based care is literally like the driving force that makes collecting outcomes data possible. Like, it doesn't matter what plans you have for how you're going to use that data, and all the different value that can come from collecting outcomes data at scale. If your clinicians and clients aren't engaging and completing assessments, then nothing else really matters. And so if you try and implement measurement-based care, just by starting to collect outcomes data, but you don't spend the time engaging your clinical staff, having them feel involved in the process and putting the clinical value front and center, you really won't be setting yourself up for success. And so for any of you who are thinking about implementing measurement-based care, make sure that you let the clinical value be that driving force of your implementation, and take the time to truly make sure your clinical staff is bought in and engaged. In the short term, nothing else should really matter more than that. Number 2 is to measure what you treasure. So I've seen so many practice owners begin to practice measurement-based care by using commonly used outcome and measures just because they're commonly used. So the PHQ-9 and GAD-7 are great examples of these. And under certain circumstances, they can be just fine. But what I would recommend you all do who are thinking about measurement-based care implementation is to pause for just a moment and truly think about what a successful outcome is at your clinic, like what it actually looks like for a client, and then orient around that. So there's this fun little outcomes narrative exercise that I found helpful to determine which measures might be a good fit for you to use in your practice. First, you'll want to identify what we call your ideal client profile, which for private or group practice owners out there is essentially like the type of client that you had in mind when you first built your practice. So try and create a persona around this client, or even bring to mind a client that embodies that ideal client profile. And next, write down, create an actual narrative of what a successful course of therapy looks like for this person. Like, what do they want to achieve? How would they benefit? What's the outcome? Be as specific as possible. And then what you'll want to do is try and pick out key components within that narrative that are measurable. So let's say your narrative is around like a persona who comes into therapy, someone who's seeking help for some unresolved trauma. Throughout the course of therapy, they have a great experience with their therapist. They feel connected and comfortable. And as a result of that environment, they end therapy with a greater sense of purpose in their life and with less symptoms interfering with their day-to-day functioning. So if you start to pick apart the themes in there, there's things like therapeutic alliance, there's things like trauma or PTSD potentially, there's a sense of purpose, all of these different things are measurable things. And then of course, the last step is to connect those different components to identified outcome measures. And for most people out there, this is probably the hardest part because most of us aren't measurement experts. And so whenever possible, I would certainly recommend consulting with someone who can help you identify the right measures for your practice based on this narrative. But I will say that there's literally hundreds of different measures out there, most of which are freely available to use and can cover a wide range of different things. And so don't be scared or afraid to branch out of the standard PHQ-9 and GAD-7. And over the long term, 6 to 12 months down the line, it's going to be much better to be tracking things that are uniquely tied to and relevant to the specific work that you are doing. And then last but not least, from doing this for years now, I can tell you that for a measurement-based care implementation to be successful, it needs to check these 3 different boxes. So one is that the system or process you use needs to be easy for clients to complete. So brief and simple is the way to go. Whenever possible, find a system that can meet clients where they are, both with their comfort and access to technology or some way of completing measures. So for clients who have phones, there's systems out there that can send assessments through text or email, which is great. For others, it might be easier to complete assessments while waiting for their appointment in the waiting room or on a tablet or a computer. And then lastly, whenever possible, take away any barriers to completing assessment. So if a client has to use time during their session, that's a barrier. If the client has to remember passwords or usernames to access their assessment, that's a barrier. You really want to remove all of the different sort of points of friction that can make it challenging for clients to just quickly complete assessments. Next up, you want to make sure that it's actionable for clinicians. And by actionable, I mean it's easy to interpret, it's relevant to their treatment, and it has clear actions to take in response to whatever might be going on in that client's data. What I've generally found is that clinicians rarely ask for more data, and it can be easy for therapists to feel overwhelmed with numbers and with data. So you want to make sure that the measurement-based care implementation is focused not on the data itself, but on how you and your therapist can act on this data in some way to make your job a little bit easier. And then lastly, whenever possible, you'll want to make your measurement-based care implementation embedded into your existing workflows and systems. So if you're having to redesign your existing policies and procedures just to fit a new measurement-based care platform, then you probably aren't set up for success. So in order to achieve this, you'll want to explore things like EHR integrations. And so measures can just live right there in your EHR if you don't have them there already. You want to make sure that the systems you use, and specifically the specific types of measures that you use, are similar or identical to the ones that you and your staff are already used to using. And then you'll want to make sure that whatever you use is customizable and flexible, because everyone in every clinic has slightly different ways of doing things. And ideally, the measurement systems that you use feels like a natural extension of your existing ways of being as a therapist or as a practice. And so in summary, for measurement-based care to work effectively and efficiently, it really needs to be easy for clients, actionable for clinicians, and embedded into existing workflows and systems. And with that said, we are right on time. So I wanted to give a huge thank you for all of you who joined me this afternoon. If any of you have any questions or comments about this material, I know there's a lot that was covered in a little bit of time. Please do feel free to reach out to me directly. I'm always happy to be a source of support and knowledge for any of you who are beginning the process of implementing measurement-based care. And then for those of you who are actively looking around for a measurement-based care solution, I would certainly recommend Blueprint. It's really easy to get started. You can sign up for a free 30-day trial to test it out on your own and see if it's a good fit for your practice. You can do so by going to the website at www.blueprint-health.com. And with that, I hope you all have a wonderful rest of your day.